So again, I'm Brett Hendel-Paterson, one of the global health faculty at the University of Minnesota, and today we'll talk about global health and pre-travel preparation. Um, so in general, I think there are a number of ways to access global health. I mean, certainly you can do global health as a tourist and have a perfectly good experience. You can also study abroad, kind of the classic study abroad time in medical school or college. And then another possibility is to do service work or job related things. And this can take a number of forms as well. You can either do it as a volunteer, either short term or long term. And I know at least some of you have done or will be doing kind of service related work. Another possibility is to look for a paid position, and that's kind of things like MSF, Doctors Without Borders, looking at governmental jobs, possibly working with the State Department, or even working on grants. Certainly in academia, a lot of people do research abroad. And then another possibility is to be faculty at an international university. My own background during medical school, I grew up in West Central Minnesota, having not done a lot of traveling outside the U.S. Before college. And my orientation was completely flipped after spending some time in India and Zimbabwe during medical school. And it really just increased my passion and my interest in global health. I stuck around at the University of Minnesota because I was able to do global health work during residency and continue some research. And then finally, I did a little bit of work in Haiti after the earthquake in 2010. And professionally, I've managed to continue working in global health, kind of co-directing at least the online portion of our global health course, and I'm one of our core faculty in global health in the University of Minnesota. There are a number of benefits of service abroad, and I think in general, it's important to realize that the vast majority of the time, you're going to get far more out of the experience than you give to it. Some of the other things that you have the opportunity is to get to do more with less in terms of working in a resource poor setting. And certainly just often due to the health disparities that are that are present, there can be a real sense of purpose. The focus in international health truly ends up being on the patient when you're in a low resource setting. And you get to challenge yourself and your thought process, and as well as seeing and doing new things. And, some of the other things that shouldn't be underestimated are the opportunities to meet new people and to experience a new country as more than a tourist. And really, when you're going, you get to have these deeper relationships and things that you would never get to do if you were just kind of visiting. So with that in mind and knowing those benefits, you really do have a responsibility when you go anywhere. You need to understand that you will be a burden. You're going to tax the resources to some degree. You may be taxing the resources of the group that you're with and to the people you're trying to serve. So poor planning, I think, was very, very evident in some circumstances around the earthquake in Haiti. On a selfish level, poor planning can lead to getting less enjoyment out of the experience, learning less than you otherwise would, and at worst, a risk of illness and injury. Now, if you plan poorly as a group, or just if you aren't holding up your end of the bargain, the group can actually lose you as an asset, and on top of that, end up diverting resources, both time and materials, away from the mission and the work that you're trying to do. And finally, this can have broader implications. There can certainly be liability concerns if things are done poorly. And also, there can be impacts on subsequent students and volunteers. And more importantly, it can lead to problems down the road where a certain group or a university may just not be invited back. So this is me. This is from my service in Haiti. I wasn't taking good care of myself, and I ended up with a traveler's diarrhea. And, in the classic medical model, we just kind of said that, go ahead, Semper Fi, and keep seeing patients until I started to get lightheaded when I was seeing patients. And, it was something we could all kind of joke about, the fact that I needed a couple liters of fluid, and they would tank me up with a little bit of food, but it really was a sad waste of resources. And again, not only was I removed from the possibility of continuing to see patients when I was in this disaster setting, it also meant that somebody from my group had to babysit me while I was sick. And really, that's just not fair to other people. So, there are a host of possibilities for international work. And really, it's very important that you do your research. There's really no excuse in this internet age for not doing your research. And we're going to talk next about some ways to take care of yourself, both in terms of routine preparation and then also some just personal health preparation. So in terms of doing your research, you should have a high degree of skepticism going to a disaster scenario or a low resource setting if your group is completely new at what they're planning to do. And I think it's worth thinking about and asking questions about how the activity you want to do is funded. And importantly, I think, do they involve local people in the decision making? That gets to be important because certainly in Haiti back in the earthquake after the earthquake in 2010, we would see a lot of people who just charged on in and didn't collaborate well and undermine the local medical infrastructure. You should also think about how are you going to get in and out? What are you going to do for eating? How are you going to drink? How are you going to pay for things? Where and how are you going to sleep? How are you going to do the service? And how are you going to get home? These are all things that are important for personal safety, and we'll talk more about some of them later. And one of the most important things, I think, is who is replacing you. Now, if you're starting something or continuing service, it's important that you don't end up leaving the local community in a lurch as you're leaving. This is just poor planning. So next, we're going to talk a little bit about personal pre-travel preparation. So first of all, you need to take care of yourself if you're going to be an asset to anyone else. And so you should do some self-reflection before going on a trip. And frankly, this is true even of going on a tourism type of trip. You need to be thinking about if you're up to the task. Are you up to it physically? Are you up to it emotionally? Is this going to be a real challenge? Or do you have any mental health issues that are not under control? And also, you should be thinking about how unfair it is or fair it is to your family. You should be thinking about, in a service setting for sure, bringing any supplies you might need so you don't have to go looking around for things. Always best to get a packing list if possible if you're going with an organization, and come up with a backup plan in and out. Especially in a low resource or certainly in a disaster response setting, you can't depend on the local infrastructure. And so if you don't have a backup plan in and out, you could end up in trouble. At the University of Minnesota, we now are required to purchase evacuation insurance. And after having to use this myself after getting sick in Thailand, I can tell you that it is incredibly important and incredibly valuable. This is cheap insurance and really it should be a part of anybody's trip if they're doing service-related work. So let's talk next about health preparation. The goal with health preparation is to minimize risks. That's the whole point of a lot of pre-travel work. So I'm biased, of course, as a travel medicine provider. I think if you're going on anything more than a trip to a completely, well-resourced, developed country, you should consider seeing a travel medicine provider. Travel medicine providers will help you talk through your trip. They'll help you prepare you with vaccines and some medication backups as well. If that's not a possibility, at least consult the CDC website. I think it's a fantastic free resource, and really it's good for anywhere. It's www.cdc.gov/travel, and they do a good job of helping you plan for your trip. Make sure that your routine immunizations are up to date. Some of the classic ones that we forget about are tetanus, DTaP, Tdap. You really want to make sure that is up to date. And then look at your travel-related immunizations and your malaria chemoprophylaxis. And, again, you're working to mitigate risks. And it's important to remember that no intervention is 100% effective. And so, How effective your pre-travel planning and preparation is depend a lot on what you're willing to do. And so values and risk are play into this quite a bit. In our travel clinic, I work for the Health Partners, the Health Partners Tropical Medicine and Travel Clinic in St. Paul, which is associated with the University of Minnesota as well. We see a lot of people before trips, and I can't convince someone to do something that's burdensome if they don't perceive it as a risk. It's important to think about financial costs. A lot of trips are already expensive, and then the cost of vaccines and other things play into it. And some of the things that we talk about also aren't always easy to adhere to. When you're thinking about where you're going, geography matters tremendously. You need to be thinking a lot about the risk at your destination. And a lot of things factor into risk. Are you going to a malarial area? Is there dengue present? Are you going to an urban versus rural? Are there outbreaks of illnesses, Zika virus or dengue or TB? What are the accommodations going to be like? You could stay in a hotel versus a homestay. Are you sleeping on a bed versus a mat on the floor? What kind of roof is there? A thatched roof versus a metal or plaster roof? Looking at these medications, at these illnesses, lots of these are preventable by vaccines. And also remember that lots of them aren't. So these ones in red are preventable by vaccines that you can obtain, and vaccines, with the possible exception of typhoid fever, are highly, highly effective. Typhoid fever is kind of in the mid to high 70s for effectiveness. So let's talk a little bit about a travel kit that you're going to take with you. I always recommend people take along any of the medications that you need, certainly all of your routine medications, but some of the ones that should go into any travel kit would include, analgesics like Tylenol or ibuprofen. You should almost certainly bring antidiarrheals. Loperamide or bismuth are good products. Also, as much as we talk about diarrhea, constipation is also very common when you travel. You end up sitting around a lot more. You end up drinking only bottled water, maybe drinking a little less, and then often having less in the way of fruits and vegetables. So constipation is very common. In our travel clinic, I would say that antibiotics for traveler's diarrhea are also something we prescribe frequently. You need to know the resistance patterns of the places you're going. For many parts of the world, ciprofloxacin is perfectly fine. For a lot of South and Southeast Asia, there's heavy quinolone resistance, and azithromycin is what we tend to use. If you have allergies, you should be thinking about antihistamines. A hydrocortisone cream is good for skin rashes, and then potentially, depending on what you're doing, of course, a broad spectrum antibiotics. Also, remember, especially if you're going to a service type of setting, you may have difficulty sleeping, and you should think about taking a sleep aid if you need it, motion sickness medications if you need it, altitude sickness treatment, and then also antifungal creams or treatment for vaginal yeast infections can be very important as well. Also, first aid kits, you can take a look at the list here, and certainly you can find lots of suggestions online for lists. Always remember sunscreen and bug lotion. We'll talk more about some behavioral pre-travel preparations. So behavioral preparation in general, so many of the things that we talk about when people think about travel medicine are getting vaccines and being prescribed medications, but really the vast majority of bad things that happen to people are not necessarily preventable by vaccines or by taking a medication. Some of the most accessible advice, I think, are Jay Keystone's Travel Medicine Pearls. Now, Jay Keystone is one of the, he literally wrote the book, Travel Medicine, and he is just one of the grandfathers of travel medicine. So he has these 5 pearls that I find easy to remember, and they're a little bit PG rated, but we'll go ahead and talk through them. So the first one, these are the 5 its. So don't get bit, don't get hit, don't get lit, don't do it, and don't eat fecal matter. So we'll expand on all those next. So don't get bit, This is true for both insects and for animals. So, don't get bit. It's important to think about the mosquitoes that carry Zika virus, dengue fever, chikungunya. Those are all daytime biting mosquitoes, while the mosquitoes that carry malaria are nighttime biting mosquitoes. On the screen here are my two favorite products. Permethrin over here is something that goes on your clothing. And if you treat your clothing with it, it is effective for about 4 to 6 weeks or through 6 to 10 washings. If you've heard of Buzz Off brand clothing, this is what it's impregnated with. And Ultrathon over here I like a lot because it's up to 12 hours of protection from mosquito bites. And then, of course, it's a locally made Minnesota, well, maybe not locally made, but at least made by 3M, a Minnesota company. So, of course, we have to plug that as well. But it's great. It's a very sweat-proof, DEET-based insect repellent. But the bottom line is just use dual methods for preventing bites. Next, don't get bit for vets or for people doing longer trips. Rabies is super common. Well, I shouldn't say it's super common. Rabies is something that is underappreciated. It's underdocumented, and especially if you're in low resource settings. And rabies is something that's 100% fatal. You don't want to mess around with rabies. The most common causes of rabies worldwide, what I call the big three are dogs, bats, and monkeys, though any mammal can do it. And you should also remember that the location of the bite matters. Rabies is something that travels up the peripheral nervous system to the central nervous system. And you have a limited amount of time to get the rabies immune globulin as well as rabies vaccine. So if you do get bit, you want to get wound management and also post-exposure prophylaxis as soon as possible. So don't get hit. Again, people think that a lot of people think that it's infectious illnesses that are what get you in trouble in developing countries, but really it's far more common that you're going to get in an accident. So accidents and injuries are the leading cause of preventable deaths in travelers. Does anybody have an idea offhand what are the leading causes of non-preventable deaths, or what we'd refer to as non-preventable deaths? You can use the chat function at the bottom of your screen to. So not a lot of responses. Oh, here we go. Motorcycles, says Christina. Yeah. So so Christina said motorcycles, and they are certainly, they may be one of the number one causes. Especially without helmets, right? Yeah, so not wearing helmets can certainly impact your mortality. So I guess what I mean by non-preventable deaths is that when you go to a country, the most common cause of mortality in Americans who travel abroad is things that they carry with them. So cardiovascular disease and strokes are actually far more likely to kill you than an infectious illness. Accidents and injuries are number two. So 23% of tourist deaths, and of those, road traffic accidents are number one. Homicide is number two, and drowning is number three. So all of these are ahead of infectious illnesses. Okay. So we talked about don't get bit and don't get hit. Another one that is super important is don't get lit. This is particularly important when I'm talking to college students, medical students, or other young people in general. It's true of both alcohol and recreational drugs. And, you can see, as this guy here has shown us here, it can certainly lead to impaired decision-making. And it shouldn't be underestimated that different countries have different laws on drug use. The last thing you want to do is end up in jail in a developing country because you're abusing marijuana or some other narcotic or drug. So the next is certainly something that also needs to be emphasized. I love how the CDC puts it. there are an estimated 448 million sexually transmitted infections annually. From the CDC Yellow Book, increased sexual promiscuity and casual sexual relationships tend to occur during travel to foreign countries and are frequently detected in long-term overseas travelers. Now, I think many people are familiar with the phenomenon of going somewhere and kind of letting one's hair down. I have had it happen, I've seen it in my travel clinic a few times, and anecdotally too, that you will occasionally take extraordinarily cautious people who would never drive without their seatbelt buckled, who will end up having unprotected sex in a relatively high-risk areas. Now, we all know the mechanics of how to prevent sexually transmitted diseases, so just remember, no glove, no love, and wear a condom if you have a new partner. Now, the last we're going to talk about is fecal matter. Now, anyone who has eaten lunch or is eating dinner or is about to eat is going to end up consuming some fecal matter. Now, traveler's diarrhea in general is just diarrhea associated with travel. Of course, leave it to internists and infectious disease folks to kind of geek up diarrhea. So classic diarrhea has been categorized as greater than 3 unformed stools per day with at least one accompanying symptom of nausea, vomiting, abdominal cramps, pain, fever, blood, and stools. Moderate traveler's diarrhea is 1 to 2 unformed stools with one symptom, and mild is 1 unformed stool, 1 to 2 with no symptoms. So really, these are just research definitions. So this is a study out of JAMA in 1983, which looked at a whole bunch of people who got sick when travel, and they looked at the date of the stay abroad and when the traveler's diarrhea came. And so what you can see is sort of a bimodal peak here. You can see a peak at right around day 3 and a bit, and another one around day 11 or so. Just basically showing that this is when traveler's diarrhea was most likely to happen. And the good news is that it tapered off fairly quickly. You can see the curves here. So who gets it? Well, it depends entirely on where you're going and how the hygiene is where you are. I've heard numbers from 20 to 90%, from 30 to 70%. But in general, most of the people who are going to get traveler's diarrhea will get it in the first 2 weeks of travel. And of these, 9 out of 10 will resolve in a week, and 98% resolve within a month. Now, I really don't want to be in the 1 person out of 50 who has traveler's diarrhea that's lasting longer than a month. So here are just a list of some of the etiologic agents, and essentially anything that can cause diarrhea when you travel, and hence traveler's diarrhea. So what do all of these have? They're fecally orally transmitted. So look, fecal oral transmission is around, it happens in the US. I always find it interesting that people will get offended by E. coli contamination of spinach or norovirus at Chipotle. And they'll talk about it, and it comes across as vaguely dirty, but I really think if we wanted to improve public health, we would get farther if we would just let everybody know that what they're doing and why they're getting sick is that they're eating fecal matter. I mean, that is, by definition, that's how these are transmitted. So if you look at specific agents, enterotoxigenic E. coli is number 1 worldwide, and Asia Campylobacter is slightly ahead. Shigella is common, and Giardia is also fairly common as well as our top parasitic cause of diarrhea. Now, this may be my favorite slide in the whole talk. This is a summation of some studies that were done in a few different locations on, in general, I would say probably one of 3 populations, either prisoners, Army recruits, or medical students. So it's worth thinking about the agent when you think about how much of it you need to consume before you get sick. So these were based on some studies that actually fed people increasing concentrations of these infectious agents to pretty much categorize at what point they got sick. So if you look at Salmonella and E. coli, which are two of our very, very common agents of traveler's diarrhea, you need to ingest around 100,000 organisms to get sick. Okay, so that's a lot of fecal matter that you need to eat. Now, Vibrio species is 10 to the third. Campylobacter is quite infectious at around only 500 organisms. Then you get down to Shigella, Giardia, and Cryptosporidium, where it's somewhere in the 10 to 100 organism range. So you can see things kind of decreasing logarithmically here. And then you look at the enteric viruses, Norwalk, things like that, can be infectious when taking in as little as one viral particle. And anyone who has a kid who has been sick with a diarrhea, or anybody who has been through the wards when a norovirus, or a cruise ship for that matter, when a norovirus outbreak rockets through, can attest to how infectious that bugger is. So what do you do to minimize risk? Well, you know, the classic recommendations are cook it, boil it, peel it, or forget it. And these have been around really as long as there have been travelers. Way back in 1692, the Dutch East India Company, even before public health even existed, they would warn the colonists not to eat salads because it would increase the risk of getting sick. And you know, we think of this cook it, boil it, peel it, or forget it as kind of standard pre-travel advice and kind of good common sense. Now, there's a little bit more subtlety to it. You know, they actually compared in one study many years ago people who rigorously adhered to the cook it, boil it, peel it, or forget it, and those who didn't. And they found that the people who were more anal retentive, pun, I guess, mildly intended, were actually more likely, the people who were more cautious, who are being extra careful about everything that they did, they were more likely to get diarrhea than the people who were just eating whatever the hell they felt like. So what really seems to matter across a few different studies are things like consumption of ice. Ice is often made with unpurified water. The duration of travel is affected. Remember that your two peaks for traveler's diarrhea are going to be in that first 3 to 5 days, and then at day 11. So if you're taking a 1-week trip and you make it to day 4, you're maybe going to decrease your risk of getting it, and then the longer you're there, the more it'll pick up. There have been some plus minus studies about whether or not hand washing after you use the restroom before eating make a difference. Tap water consumption seems to make a difference. Eating raw or undercooked meat, and also eating street vendor food. So knowing that the association between very careful, rigorously adhering to recommendations hasn't been definitively shown to make a difference. The CDC from the Yellow Book says care in selecting food and beverages for consumption might minimize the risk for acquiring traveler's diarrhea. A few things that I think are good practical advice to think about. Piping hot is safer than buffet food. You know, you should avoid beverages that are prepared with or diluted with non-potable water. A few other risky foods, we mentioned the raw or undercooked meat, seafoods, unpeeled fruits or vegetables. And in general, safe beverages include bottled carbonated beverages, hot tea or coffee, because in general, the standard for heating is about 160 degrees. So if you've reached 160 degrees for about 5 minutes, that should kill off anything that's in there. Beer, other alcohol forms are generally safe. The alcohol tends to kill off the other pathogens. And then again, water that's boiled or appropriately treated. So you can look for signs. This is a sign from when my wife and I were traveling through India many years ago. We found the Apsara restaurant, our home, barge in for clean and hygienic continental food. Yes, we are less dirty. You can look for signs like that. Or you can just eat less poop. Remember that some of the more common causes require of traveler's diarrhea, Salmonella and E. coli in particular, it require a fairly high infectious dose. That's why foods that have been sitting around in buffets both have more, both are riskier because of their amount of hands that have been touching it, and because they may have been sitting out longer. So my corollary to Keystone's travel medicine pearls and the eating less, don't eat fecal matter, is that really what you need to do to decrease your risk is to eat less fecal matter. So just don't do it. So you can stay away from it. So safe foods, but what I mean by safe is that foods that are dry, that bacteria couldn't grow in. So crackers, hard cookies tend to be safer foods. Remember that more hands equals more fecal matter, and buffet foods and just are more likely to be contaminated just because more people are touching them. You can filter out the fecal matter that's there using a water filter or by buying bottled water. You can wash the fecal matter off, so clean washed foods, things that you're washing yourself. You can heat it, right? As I said before, once things reach 160 degrees, that will essentially kill off any of the pathogens. It doesn't necessarily mean that you're drinking good quality water, and you should still pay attention if you have to worry about heavy metals like lead or other things in the pipes. You can kill it. Carbonated beverages and alcohol usually kill it, or iodine, chlorine dioxide, or chlorine can also get several. So how about medications? Well, in general, if you do get a traveler's diarrhea, the most important thing is just staying hydrated. So, ORS solution, oral rehydration solution, has been one of the biggest public health interventions in terms of reducing mortality worldwide, and especially childhood deaths from diarrhea. You can also drink other liquids until the thirst is quenched. Symptomatically, you can take bismuth subsalicylate, a tablet every half hour for up to 8 doses, or loperamide, 2 tabs after the first loose stool and a tab after each additional one. There are a number of antimicrobial treatment options. Remember that bacteria are the more common cause. In general, around 2/3 of the traveler's diarrhea that's out there is related to a bacterial cause, and with that in mind, taking a treatment course of an antibiotic is reasonable. Remember, in Asia, Campylobacter is the #1 cause of traveler's diarrhea, and there's very high resistance. From some older studies, 70% Cipro resistance in Nepal, varying prevalences in other studies, but it's very high. Unfortunately, anything that we use, we will lose eventually. We used quinolones, we overused quinolones, so now we have quinolone resistance. We're also seeing azithromycin resistance, and we'll probably see more extended spectrum resistance. So, in summary, we're just about to wrap up here. I strongly encourage people to travel and do it in whatever capacity you feel a pull to do it. I don't care if you're a tourist. I don't care if you're a volunteer, missionary, working for MSF or whatever. But just remember to prepare yourself. Make sure you're up to the task personally. Make sure you're doing what you can to minimize the health concerns, getting the vaccines that you need, and then remember to take appropriate precautions. Keystone's travel medicine pearls: don't get bit, don't get hit, don't get lit, don't do it, or if you do, remember a barrier method, and don't eat fecal matter, and remember my corollaries to it. And of course, in general, my biased recommendation is that you should strongly consider seeing a travel medicine provider, and you really should do this 4 to 6 weeks before you leave. And that's just to make sure that some of rabies in particular, Japanese and some other ones, have time for you to complete the whole course. So again, there are some excellent resources out there for travel. The CDC Yellow Book is a fantastic one. We run our global health course, both we have an online component as well as a live component. If you're in Minneapolis, or you'd like to just log on, University of Minnesota, we do monthly travel medicine seminars, except for during the summers. One Health talks about the intersection between human health, animal health, and environmental health. ProMed Mail is an excellent resource for outbreaks that are out there, and actually there's an app that you can get on your phone called Health Map that has an output where you can actually just pull up with mapping what outbreaks are there near you. And the International Society of Travel Medicine is also an excellent resource, istm.org, for finding a travel medicine provider near you. So those are the things that I wanted to cover in terms of my talk. I guess at this point, what I'd like to do is open it up to questions. I know that was a kind of a charge through this topic. So yeah, does anybody have any questions? You could either turn on your microphone at this point, or you can do some texting of comments. I'm going to stop my screen sharing for a minute so I can go back to the main page. Okay, well, if that's the case, just in case, I'm going to try and unmute these microphones just in case someone is trying to talk. Anybody out there that has anything they want to say? Okay, well, thanks a lot for everybody for participating. I appreciate it, and I hope you found it useful, and have a good rest of your night. I'll just, I guess I'm going to end the meeting here.